During today's session, we will be discussing urinary tract infections, UTIs, in nursing home residents. UTIs in nursing homes pose a significant health threat to residents. The Centers for Disease Control data show that catheters are involved in about 75% of nursing home UTI cases. UTIs rank as the second most common infection in long-term care settings, trailing only respiratory infections. Cleveland Clinic states that women are particularly at risk, with a lifetime incidence rate of 50 to 60%. Today's session objectives are to identify the causes of UTIs, adverse signs, symptoms, and behavior patterns that could indicate the presence of infection, to describe the importance of early detection and intervention to prevent further complications, and finally, we will discuss preventative practices to eliminate development of UTIs. UTIs are a common and serious issue in nursing homes. They are the most common bacterial infection in residents, accounting for over a third of all nursing home-associated infections. Symptoms can be subtle or atypical in residents. Diagnosing UTIs in residents can be challenging due to age-related changes in urinary function and cognitive decline. Antibiotic treatment comes with its own risks and at times is ill-advised. Another compounding factor is that if true UTIs do not receive treatment, they can spread to the kidneys and other organs, potentially leading to sepsis or death. Urinary tract infections, UTIs, are prevalent in long-term care settings due to a combination of factors that create an environment conducive to bacterial growth and infection. Poor hygiene practices, such as inadequate perineal care and delayed changing of soiled incontinence briefs, facilitate the entry of bacteria into the urinary tract. Additionally, unclean hands of caregivers can introduce pathogens. Common bacteria responsible for UTIs can ascend through the urethra. Improper catheter management, including prolonged use and the formation of incrustations, can obstruct urine flow and promote bacterial colonization. An unsanitary environment, exemplified by infrequent bed linen changes, further exacerbates the risk. Structural abnormalities such as bladder prolapse, neurogenic bladder, prostatic enlargement, lack of circumcision, and urinary stones also predispose individuals to UTIs. Moreover, age-related physiological changes, cognitive decline, chronic dehydration, and underlying health conditions like diabetes contribute to increased susceptibility to these infections. Monitor for these main symptoms to indicate the presence of a UTI: a strong, persistent urge to urinate, burning feeling when urinating, feeling of incomplete bladder emptying. Strong smelling, cloudy, bloody, or dark urine may indicate a UTI, but these urine changes can also be impacted by diet or medications. Pain in the upper back and side or lower abdomen. Pelvic pain can also signal that a UTI is present. In nursing home residents, UTI symptoms can be difficult to spot because they may not appear or be too subtle to notice without scrutiny. Other signs that could indicate a UTI in an elderly adult are frequent falls, confusion, dizziness, agitation or aggression, fatigue and lethargy, and decreased appetite. How do you know what the resident is experiencing is really a UTI? Could it possibly be some other condition? Think about what condition symptoms are similar to or could mimic a UTI. Are the symptoms side effects of a medication the resident is taking? Is the resident ingesting too much caffeine that is irritating the bladder? For women, is it possible that a yeast infection is occurring, or do they have dry vaginal walls causing irritation? Could the resident have kidney stones? Is their diet high in acidic foods or beverages or spicy foods? Does the resident bathe with perfumed soap that causes a change in their pH? Other conditions that could mimic symptoms associated with a UTI include overactive bladder, prostatitis, diabetes, appendicitis, and certain types of cancer. The provider should investigate and consider these options prior to prescribing antibiotics. To help prevent urinary tract infections in nursing home residents, staff and caregivers can implement several effective strategies. Encouraging residents to stay well hydrated by drinking plenty of water throughout the day aids in flushing bacteria from the urinary tract. If urine appears cloudy, dark, or has a strong odor, increasing fluid intake for a day or two before collecting a urine sample can help determine if dehydration is the cause, potentially avoiding unnecessary antibiotic use. Residents should also be encouraged to urinate regularly, even without a strong urge, to ensure the bladder is fully emptied. Minimizing the use of urinary catheters and adhering to facility protocols for changing them, ideally every 30 days, can reduce infection risks. Proper hygiene practices are essential. Wiping from front to back after bathroom use, regular showering, avoiding douching or scented products in the genital area, and thorough hand washing after restroom use. Wearing loose-fitting cotton underwear and pants can prevent irritation. Cranberry supplements may also be beneficial. Some studies suggest they help prevent UTIs by preventing bacteria from adhering to the bladder wall. Certain groups require additional considerations. Women are more prone to UTIs and should focus on proper hygiene and frequent urination. Postmenopausal hormonal changes can increase UTI risk, so consulting with healthcare providers about preventive measures is advisable. And for residents with diabetes, managing blood sugar levels is crucial, as diabetes can heighten susceptibility to infections, necessitating close monitoring even with preventive measures in place. In summary, UTIs occur often in the nursing home environment. Regular assessment of risk factors, hygiene habits, individualized care plans, and collaboration with the nursing home team are essential for effective UTI prevention and management. Preventative practices can limit or even eliminate the occurrence of UTIs. Here are our references. Thank you for listening to this presentation.